Lot of you have asked me about how to read CT scan report for COVID-19. So today, let's see how we can read a CT scan report. Hello friends, I am Poonam and you are watching Biology Explained. First of all, you have to know that CT score and CT value are not the same. We get CT score when we do CT scan of our lungs for COVID-19. On the other hand, we get CT value when we do RT-PCR test where the swab is taken from the nose and the throat. Is it clear? If you want to know more about CT value, I have a video. I will add the link in the description and also in the card above. So in CT scan, we see how much lung is affected due to COVID-19. A typical CT scan report will look like this. You will notice two things in the report. One is CORADS score and the other is CT Severity score or CT score. First, let's talk about CORADS. CORADS is COVID-19 Reporting and Data System. CORADS categorize patients according to the likelihood of patients having COVID-19 with lung involvement. That is, it says whether there is a chance of COVID-19. CORADS score from 1 to 6. Let's see what each CORADS score means. CORADS 1 means no chance of COVID-19 and CT scan is normal or abnormalities which are because of non-infectious disease. So we all know that COVID-19 is an infectious disease. So CORADS 1 is because of non-infectious disease. CORADS 2 means there are abnormalities due to infectious disease but not COVID-19. CORADS 3 means lung involvement can be due to COVID-19 but can also be due to other pneumonia. CORADS 4 means there is a chance of COVID-19 but also possible because of other viral pneumonia. CORADS 5 means very high chance of COVID-19. And CORADS 6 is given when there is RT-PCR positive for COVID-19, so it is confirmed COVID-19. So if one has COVID-19 infection, you will get a CORADS score of 4, 5 or 6. Now let's see the other parameter, that is the CT score or the CT severity score. We have two lungs, the right lungs and the left lungs. The right lungs is divided into three lobes, right upper lobe, right middle lobe and right lower lobe. And the left lungs is divided into two lobes, left upper lobe and left lower lobe. So total there are 5 lobes. Each lobe is given a score of 5. So in total we get score 25 for the total lungs. Now this table shows the score of a single lobe involvement. That is, depending upon how much lung involvement is there, a score is given to each lobe. For example, if it's 5% or less, then the score is 1. If the lung involvement is 5% to 25%, then the score is 2. If the lung involvement is 26 to 49%, then the score is 3. If the involvement is 50 to 75%, then the score is 4. And if it is above 75%, then the score is 5. And you know, right, the maximum score can be 5. Now let's see an example how scoring is done. I have kept the table on the right side for your reference. Now for example, if the right upper lobe has lung involvement of 26 to 49%, then the score will be 3. The middle lobe has lung involvement of less than 5%, the score will be 1. The lower right lobe has involvement of 50 to 75%, so the score will be 4. Again, similarly for the left lung, the upper lobe has involvement, let's say 5 to 25%. So the score will be 2. And the lower lobe has involvement of 26 to 49%. So the score will be 3. So if we sum up, what did we get? 3 plus 1 plus 4 plus 2 plus 3, that is 13. That is 13 out of 25. So what does this mean? Is the disease mild, moderate or severe? Now we'll see a table which will tell us whether the disease is mild, moderate or severe. If the total score is 7 or less, then the disease is mild. If the score is between 8 to 17, then the disease is moderate. And if it is more than 18, then it is a severe case. In our case, the disease is moderate because it is between 8 to 17. Is this part clear how we get the CT severity score? So, in case of CT scan, if the score is higher, then it means virus has infected the lungs more severely. While CT value which we get from RT-PCR, it is completely different. Higher the value means low viral load. So now you know the difference between CT scan score and CT value. But remember, RT-PCR and rapid antigen test can only tell whether one is positive or negative. CT scan is a test which says that how much damage has been done to the lungs due to the infection of COVID-19. So, if you feel that you are having COVID symptoms, first and foremost thing to do is to do a RT-PCR test. Although rapid antigen test will tell you whether you are positive or negative, but RT-PCR is the best way to tell whether one is positive or negative. You can do RT-PCR test as soon as you develop symptoms. If it comes negative, try again after 2 or 3 days if the symptoms persist. CT scan should be done at least 4 days after the symptom onset and preferably after RT-PCR confirmation. If one does CT scan on day 1, the results will show very less or no lung involvement. But as the days pass by, the virus will invade the lungs. So it's better to do a CT scan only after or on day 4. Moreover, don't do too many CT scans as it might increase the risk of cancer development in the later stage. Consult your doctor before doing a CT scan. So higher CT scan score means more lung involvement and higher CT value means less virus in the body. That's it for today, guys. If you found this video informative, don't forget to hit the like button and subscribe for more updates. Thank you.